Okay, sort of do a quick repeat of the introduction now that we started the recording for folks that aren't with us live tonight. My name is Claire. I'm filling in for Dawn for tonight's NEDA Know How session. We're really excited to welcome Dr. Kari Searls from Millbrook Equine to do a presentation about common first aid and troubleshooting common issues. So welcome. I'll let you do a quick introduction of yourself. Quick reminder, everyone, please feel free to ask questions in the chat, and I'll get the presentation up and running here. Okay, how's that look?
Awesome. That's beautiful. Thank you very much.
You're very welcome. All right, take it away.
All right. I'm Dr. Kari Searls. I've been with Millbrook Equine for almost 2 years now. I graduated from Iowa State University in 2018, did an internship in California, and have been in private practice since. So I am going to talk to you guys today about common equine emergencies, as well as a little bit of first aid, and then how you guys can participate when you're waiting for your veterinarian and then after we see your horses. Okay, so just an overview of today's topics. We're going to go over a couple of common presentations and then things that you may call us for. So we're going to talk about colic, choke, eyeballs, significant and acute lamenesses, wounds and foreign bodies and fevers, as well as a first aid kit, what you might want to have on hand, emergency preparedness at home and on the road, and then questions and discussion at the end if you guys want to. So something to know before we delve into this venture of emergencies, because I know when we're in stressful situations, it may be we forget some of these really common numbers that we have in the back of our brains somewhere, but it may be something that, you know, you're panicking, your horse is bleeding, your horse isn't doing well, it's rolling on the ground. Oh my gosh, what is a normal temperature and how do I go from there? So one of the things that I very, very commonly recommend to my clients, go through your normals. And if you guys are thinking of it, when you go and you tack up your horse in the morning before you ride, go through these things. Normal temperature, anything above 1015 is typically what I term a fever, and definitely warrants a call. Anything above 44, and granted, there is some variability within a horse. So getting to know what's normal for your horse is also very important. Normal breaths per minute is 10 to 14 per minute. Sometimes we'll see upwards of 20 may be normal for your horse. Capillary refill time or the gum color, as well as when you put a little pressure on their mucous membranes or their gums, how fast does that color come back? And then again, the mucous membranes, looking at, are they moist? Are they dry? Are they tacky? Are they pink? Are they red? Are they purple? Are they scary colors? Or are they normal for your horse? Awesome. So some of the things to keep in the back of your mind before we get into these stressful situations, having these things mastered is a great idea. So easy access to important phone numbers, like not only your veterinarian, and if they have a different emergency line, it's a great idea to have that posted in your barn, on your horse's stall, have it taped to the back of your phone, have it tattooed on the back of your hand. The other thing that may be important for you guys to have access to, if you don't have the ability to trailer your own horse, knowing what companies in your area trailer horses, especially on an emergent basis, is very, very important. Or having a couple of friends that have access to a trailer is also quite important. On the same line, again, when we're in stressful situations, you're panicking, your horse is panicking, things are kind of going haywire. It's good to have that loading system down, to know that your horse can get in a straight load, a slant load, a head-to-head. Those are all good things to practice in non-emergent situations. So you're not sitting there trying to load them for an hour while they're trying to roll on the ground. So always recommend having not only a trailering plan, but knowing that your horse is going to willingly get on and off the trailer. Is a great idea. Knowing where your closest and desired referral situation. So we're very fortunate in this area in that we have a lot of referral hospitals, not only private practice, but universities. So keeping in mind that maybe not in a emergent situation, you may not be headed to Cornell or Tufts, but knowing what referral is close by, how far you're able to travel, and knowing where you might want them hospitalized is a great idea as well. As much as we all hate talking about it, keeping a budget in mind. While we don't really want to consider money as we go forward in these scary situations, it is important to know that referral is expensive, and knowing what you can and want to afford is a great idea. And definitely, if your horse is insured, knowing what plan you're on, knowing your provider, and also having their number somewhere handy, where you're not having to look it up, is a great idea. Knowing that your horse is covered, having an insurance policy number is also a phenomenal idea to have. Put it on your note on your phone as a note, is easy place to access it. And then this is my first of many soapboxes for tonight. Don't administer any medications without talking to your veterinarian first. Banamine and bute are wonderful, wonderful drugs. However, we can definitely use and abuse them. And some veterinarians like to see your horse before they've had any medications. Some veterinarians may advise you to give things. So those are all things to keep in mind as you go forward prior to emergencies. And if you don't hear from your veterinarian, it's always a good idea to ask us. Sometimes we get a little flustered too, but ask if they want you to give her any medications, bute, banamine, or if sedation is available for you guys. It's also a good thing to keep in mind. So very common, I'm sure we've all experienced this, is colic. While it's kind of a vague, diffuse term, something that makes us all panic a little bit, it has many presentations ranging from very, very mild to very, very severe. So some of the most common presentations that we hear from owners, the horse is rolling or lying down more frequently than normal. They may be pawing or lip curling, like phlegm in response, or stretching out like they're trying to relieve some pressure in their abdomen. The other most common presentation is no appetite. So they decided they don't want to eat their dinner, they're not interested in their hay, or they might have mild changes in their appetite. Maybe they take a bite and walk away. Some of the things we like to know as you guys see these present in your barn is a TPR, temperature, pulse, and respiration. While some of us don't feel super proficient as far as taking a pulse or listening to their heart with a stethoscope, knowing some of the easy areas where you can access that, like right under their jaw is an easy place to take a pulse. Knowing that normal, anything above 44 to 48 is where we start to go, maybe they're painful. So as our horses become painful, their pulse increases, they might have a little bit of nostril flare, they might be breathing a little harder, or they may have something like an abdominal effort where they get to really push their core muscles to breathe. Well, if you have a horse that's throwing itself on the ground, temperature might not be the best way to proceed, but if you can get a temperature on a normal stable horse and be safe, that might be very helpful to your veterinarian, as well as some of these colics may present with a low-grade fever. That gives us quite a bit of information too before we see them. I typically don't advise that owners turn them out unless they're hurting themselves. So if we have a horse that's in a small stall thrashing and getting their legs cut up because they're hitting the wall, hitting water buckets, that might be a situation where we advise that the horse goes outside or in a larger area. But typically we'll keep them in the stall so we can monitor comfort, we can monitor those vital signs, and then we can monitor manure output as well. So in the same line, monitoring manure production. One of the things that we notice a lot of times as well is they were maybe a little quiet at night. You came in the morning and your horse's stall is usually full of manure. They have 4, 5, 6 piles. They made a bed in the corner. They're definitely messy. And maybe you come in the morning, they're standing quietly in their stall and they have 1 or 2 piles. Maybe it's a little dry. So I think those are all great things to comment on as well as you talk to your veterinarian when you give them a ring. Again, the appetite might change. They might have mild changes where they go and they take a bite, they walk away, they show no interest in something that they're usually very excited for. And then any administration of medications or recent changes. So some of our horses, we might have a little alarm bell that goes off in the back of our minds. If you say, well, we recently started him on stall rest because of a lameness issue that we've been having in the past. Oh, and he's on SMZs. And we've been administering some medications that he doesn't normally get. That might trigger something in our brain as a concern for a primary source of colic versus something else. So indicating what medications your horse is on is always very important to us as well. So this is the long-term debate that I always get questions about to walk or not to walk. So I think walking your horse isn't necessarily going to stimulate any motility in the GI tract. But if you have a horse that's trying to throw itself on the ground, is hurting itself by rolling, is getting cast while rolling, I always advise owners to walk. The other thing that it allows us to do is monitor what's changing. It's an easy way to monitor their comfort change. So if we go out and walk and they're just kind of blah, but then we've been walking for 5 minutes and they want to stop, they want to buckle, they want to try and stretch out, I think those are all easy ways to note that. Plus, it gives us a time to hang out with them too, while we're not running around like chickens with our heads cut off, panicking because, oh my gosh, my horse is colicking. And then care after colic. While colic is a very, very vague term, there's lots of things that we can do and lots of common things that we do when we manage these on farm. So things that we typically have our clients do are things like remove food. While your horse gets very, very upset about it, we get to then monitor manure production, comfort, making sure that they are not adding to if they have an impaction. So a lot of times what we'll do is we'll fast our horse overnight, and then gradually increase feed and see how they respond to us. These are kind of all excluding our colics that require referral. Again, keeping in mind how far you want to go with your horse. My second soapbox for the night. Referral doesn't necessarily mean surgery. So lots of horses will go into the hospital for medical management of colic. So running fluids, frequent tubing, and knowing that it is always a good idea. I know sometimes owners, it looks really awful when we pass nasal gastric tubes so we can tube their stomach, but it is quite useful. And that's something our horses that tend to develop impactions, that might be something that's facilitated much easier in a hospital setting. Whereas on the farm, when your vet has to come out multiple times in a day, might not be as easy or as rewarding as we go forward in our care. AAP has these wonderful graphics. I think the cartoons say it all, but it's really easy to recognize some of those signs then. So lying down, rolling, stretching, flank watching, and then elevated pulse rates and sweating, and then kind of the degree of changes. I feel like those are also things that would be really easy to post in the barn too. Visuals are always helpful, especially in a time of need. Our next very common emergency that has owners panicked. So when we say things like choke, a lot of people become quite concerned as far as, I need the veterinarian here now, we have minutes, what is going on? Why are we not handling this? There's a big difference between esophageal choke, which is what we see in horses, versus like when we talk about people, which is a tracheal choke. So if you think about somebody going to Burger King and eating a hamburger and then choking and eating the Heimlich, that's a tracheal choke. So that blocks your windpipe or your trachea, so you're not able to breathe. What we typically see in horses is an esophageal choke. So the tube that takes food from their mouth down to their stomach, food becomes dehydrated and impacted in the esophagus. So a lot of times we commonly see horses that aren't chewing their hay appropriately. They have pelleted grain that they decided to hoover down and eat really quickly, and then it expands within their esophagus. So our most common presentation, what we notice very, very frequently, is nasal and oral discharge. Sometimes it will have feed material in it, or it'll be kind of this, like the first picture, that kind of green discolored, especially with our forages. They may be coughing. A lot of times what we'll see is they kind of have a retching motion, like they're trying to clear something out of their esophagus. And a lot of times they'll stretch their head and neck out long and low, trying to clear it. So some of the things that help us out to know are their dental history. So we very, very frequently see choke in our older horses, especially that they start to have what's called expired teeth. So the surface of horses' teeth is corrugated and rough, so they can chew those roughages appropriately. As they become expired and smooth, they may struggle with some of those rougher and coarser forages. So a dental history is quite important. Have they been floated recently? Have they had changes that you've noticed? Have they lost teeth? Have they had teeth extracted? Those are all very important things, as well as feed changes. Saying, you went from a pelleted feed and you were soaking it before, but tonight we forgot to soak it, and maybe he's a little food motivated. So I think those are all important things as well. And if they've done it before, our repeat offenders tend to be ones that give us pretty clear signs, or they don't show us at all. And then you just start to notice a little bit of nasal discharge, a little bit of coughing. But then we can be concerned about things like esophageal stricture if they're really repeat offenders or have had bad choke episodes in the past. And then again, with our TPR, this is my fourth soapbox. It's a really good idea to get a baseline temperature, notice what their respiratory rate is doing, as well as their pulse if you can get it. Some of the things that you can do while you're waiting: remove all the food from the stall, which sounds silly, but sometimes we forget. So they don't have access to it. Usually they're not motivated, but some of our more food motivated horses will put their head back into the hay and decide that they're hungry enough that they can keep eating or attempting to. And then we're just adding to that impaction. The environment. So, really channeling that nice, quiet environment, encouraging to stretch their head and neck out, keeping their head down as low as possible is also great. Not only does it help facilitate some of that draining, but it keeps them from aspirating more. And then medications. Sometimes again, sounds silly, but sometimes your mind goes out the window when things happen. Oral medications are definitely not advised. Neither are oils orally or water orally. Remove everything from the stall. If you continue to add things, or if you try to administer oral medications, it will hit the same spot and they have the potential to aspirate those, and then we have further complications. The other thing that might be advised by your veterinarian, sometimes if you have access to mild sedatives that are injectable, like acepromazine, they might advise you to give that while you're waiting. So that helps them relax. It helps them stretch their head and neck out and down. But it also helps relax everything too. So sometimes with a little bit of sedation intervention, we can go ahead and clear that with mild chokes, but always advise if they're still showing clinical signs that your veterinarian come and evaluate your horse. Some of the things, the most common and complicated sequelae or aftermath of our choke, the thing that we worry about most as veterinarians, is pneumonia. So what happens with esophageal chokes is, as stuff backs up, as they have that nasal and oral discharge, and as they start coughing frequently, they can aspirate things into their lungs. So then it just predisposes them to developing things like bacterial pneumonia from aspirating whatever's coming out of their nose. So typically advise owners to keep a very, very close eye on their temperature for the next several days. A lot of times what will happen is we see that pneumonia set up if they do develop pneumonia post-choke. We'll see it set up like 2 to 3 days, 48 to 72 hours out, as that festers in their lungs. So I typically also advise post-choke, rechecking them a day or two after, making sure everything has resolved and they're comfortable, but B, potentially drawing some blood work, as well as continued monitoring of their temperature. The other care that you guys may consider providing is not only a dental float or some routine dentistry, and just making sure everything looks appropriate, especially for your horse's age, but also maybe potentially soaking feeds going forward, or looking at less coarse roughage. A lot of these guys will be repeat offenders if we make no dietary changes, if the reason they've choked is because of their teeth, poor dentition, or if they're very, very food motivated. Some of our food motivated horses, we can consider feeding them in other ways as well, like a slow feed hay net, or splitting grain into several buckets. They do make, just like for dogs, they do make slow feeders for horses. And that is an option for grain. But considering things like soaking the feed is also a good option for most of these guys. Eyes are always a little scary, a little terrifying, but they're always an emergency in my book. So I would say most commonly the history I get from an owner is that they have their lids, their upper and lower lids are swollen and very swollen. And you may not be able to assess the eyeball itself or the globe itself, but noting that they probably had some sort of outside trauma that caused the lids to swell. So we might see tearing, we might see squinting, we might see some discharge, a little bit of that goopy white discharge in the corner of their eye. And then what we really don't like to see, but can sometimes see, especially if the horse isn't looked at every day, is a change in color or the opacity of the cornea, the outside of the eye. So sometimes, like this upper picture, you can see that kind of white develop within the eye. Again, sometimes horses are good at hiding things from us. So they might traumatize the eye and we may not see it for a couple of days, even especially if it's on the offside. So again, recommend touching every limb, looking at both your eyes, and doing a full assessment every time you go and touch your horse is a great idea. But some of those things are they're sometimes easily missed. So always advise keeping a close eye on that as well. The lower picture is a picture of a fluorescein stain. So typically when we come and evaluate your horse, we'll stain the eye as well. Ulcers can be quite deceiving in that, you know, it might look totally normal. And then you stain the eye and you're like, well, there is some trauma to the eye, and that may change our medication plan going forward. So some of the things we like to hear is if they have any previous history. So our eye in the upper picture is likely something along the lines of like a uveitis. So has the horse had previous ocular disease? Have they had color changes before? Have they traumatized the eye before? Have they had surgeries? Those are all really pertinent things to know. The other thing is if you notice something along the lines of scarring, I think that's pertinent for us to know as well, so we don't pick it up as a new injury. Or a traumatic event. So you watched your horse go outside and rub its eye on the fence, or I hope this happens to nobody, but watch your horse get kicked in the head or bang its head on the stall. So if you notice any of those things and then you notice eyelid swelling or tearing afterwards, it's not a bad idea to give us a ring. Some of the things that you can do while you're waiting for us to evaluate your horse, some veterinarians may advise you to give some Banamine. So a lot of times with lid swelling, if it is quite significant, it can be very hard for us to evaluate the globe. So sometimes administration of Banamine or bute before we come and see your horse can be quite advantageous in that we may be able to assess the globe, whereas if there's that significant amount of swelling, may require a couple of visits after some Banamine, some anti-inflammatories, and some management of the lids. And then monitoring, which sounds silly, but a lot of times these guys, their eyes are irritated. They might have a foreign body in there, and then they go and they rub their leg, or they rub their face on their leg, they rub their face on the barn, they rub their face on the stall door, they rub their face on the cross ties, and you're like, so then they just continue to repetitively traumatize the eye while it's uncomfortable. So discouraging that as much as possible is always a great plan. And then care after eye trauma or eye disease is very dependent on the process that we see going on. A lot of times what we may start with for something like the lower picture as a corneal ulcer might be topical meds as well as systemic anti-inflammatories. Some disease processes require systemic antibiotics, but I think rarely what we're seeing as far as minimal trauma on farm, we're typically not giving out something oral antibiotics because of its penetration to the globe or its access to the globe. So a lot of times it won't help whatever process is going on. That being said, if it is a significant process, sometimes we will start your horse on something along the lines of doxycycline. But a lot of times, if we have horses that are very, very adverse to having the eye treated topically, and I think I would definitely be one of those horses, and I think I would probably take somebody out if they tried to touch my eyeball. But sometimes if we need to facilitate medication, there is a piece of equipment that we call an SPL, or a subpalpebral lavage. What it is some flexible rubber tubing that we put a foot plate under one of the lids. At the veterinarian's discretion, it's upper or lower lid, and then we push medication through the tubing and directly onto the eye. Some of our horses get quite smart about topical medications, and that just helps us facilitate medicating the eye. Depending on your veterinarian's discretion, as well as your skill and competency and your comfort with the different pieces of equipment and medication administration, it may be advisable to have that done in hospital and managed in hospital as well. The beautiful thing about that too is you can have an ophthalmologist on staff to then monitor. So those are things to consider going forward as well, especially if it's not healing as needed. Lameness gets to be a little dicey as far as where we see it on an emergent basis. So I know when we see our horses and we panic, or like, oh gosh, they're off today, it's going to be awful day, I need to have somebody look at it immediately. The lamenesses that we like to see on emergency are acute severe lamenesses. So something along the lines of, not that we ever like to see them when they're non-weight bearing, but if they're really lame at the walk, or they're minimally weight bearing, those are things that we need to see on an emergent basis. So some of the most common causes that we see for those non-weight bearing emergencies, or acute walking lamenesses, are abscesses, fractures, and laminitis. So those are all things we really would like to see on an emergent basis. The other things that we like to know, do they have a history of lameness? Is this a recurring lameness that we see frequently? Is it something that has been sustained and is now just progressing? Is it affecting one foot, both feet? We have a history of laminitis. We have a history of abscessation. Those are all things that are very, very pertinent. Shoeing history. So things like recent shoeing changes, we put pads on with a wedge and we haven't done that before. They were shod yesterday and a little uncomfortable afterwards. The farrier told me that they have a history of abscessation. Last time they were here, they dug out this giant tract and we did some sort of change. So I think those are all pertinent things to know as well. As well as trauma. As much as we don't like to see it, sometimes some of us will see the horse get kicked out in the field, or if they have a history of being turned out and then coming in quite lame. I think those are all pertinent things for us to know. So some of the things that your veterinarian may have you do while waiting, again, anti-inflammatory medications like bute or banamine may be advised. Some veterinarians will hold on advising administration of any medications, as they want to see them in their full glory as far as how lame they are. They don't want any sort of drugs that modify that lameness on board when they're going to see them, as well as going forward with care. If it's something like the abscess, you're going to get 100 different opinions as far as administration of medications, of anti-inflammatory medications. Considering the environment that they're in, if it is a lameness where they're stable enough to moving them to a place where it's dry, level, and they're allowed to stand comfortably without any sort of incline, I think is relatively important. And then if you find that your horse, not that we wish this on anybody, but if you find that they have a limb that's unstable, where you might suspect a fracture where they're really unable to bear weight, or you notice that it bows in one direction or it moves abnormally, it may be advised by your veterinarian to keep them in place. So not that you guys will be doing any immobilization as far as adding a splint or a cast, excuse me. But they may advise that they stay in place until we're able to assess them. And then care after lameness is definitely going to depend on the process that's going on. So if you have something along the lines of laminitis, you're definitely going to have a menagerie of shoeing changes, environmental changes. Excuse me, I'm going to go grab a drink. One sec. Okay, so immobilization of the limb. But the care after your lameness is definitely going to depend on the process that's going on. So if you have something along the lines of laminitis, you're going to have medications that are added, shoeing changes that are added, but also some environmental changes. So they're not going to get turnout. Ooh, excuse me. And then an abscess, where we all get very, very familiar with the bucket soak, wrapping, poulticing, and then having your preference as far as something along the lines of like a paste poultice versus a pad. So those are all important things to have in mind and on hand. So what is this? Soapbox number 8. For wounds in foreign bodies, it's all about location. So knowing things like key synovial joints, like our picture up top, while you might have a wound that looks very tiny, and it might not look like any of those big scary things that you see on Facebook where the horse tore its chest open, or has a large neck wound, some of those puncture wounds, if they're in the right spot, are much scarier. So over joints and synovial structures is where we start to get a little apprehensive. So as the chart shows, those are all things to really familiarize yourself with. So the location of your key joints and then tendon sheaths, which are on the back of your limbs and towards the fetlock. So if you have puncture wounds that are in those areas, I think that's quite important to call your vet sooner rather than later. So with some of these larger wounds that access synovial structures, they may be sound until that closes up. So something along the lines of, you have a large wound that goes into the fetlock. They're not unsound. They're not super comfortable, but not unsound. And then 2 days later, as that wound scabs over, closes, they become non-weight bearing. Those are all things that we want to see day one, and things that we can assess same day. So a lot of times you'll see if they're close to a synovial structure or adjacent to a synovial structure, we'll tap the joint, we'll tap the synovial structure, make sure there's no communication with the wound, and then we'll treat appropriately based on the location of the wound. Some of the other locations that we get concerned with is locations like the chest or the abdomen. So if there's a penetrating wound into one of those cavities, that's also quite concerning. Those definitely require referral or assessment, significant assessment on farm. Some of those can be deceiving. So if you have a penetrating wound to the front of the chest, really assessing its placement is also, because we can access that thoracic cavity. And then there's quite a concern there as far as stabilization before transport and then stabilization at a hospital setting. We really love to know how long it's been there. Sometimes things can be a little deceiving. The picture on the lower left is a case that I saw in the field. While it looks kind of fresh, it's bleeding, the margins are still a little open. That wound's been there for several weeks. And I've seen it regularly for a bit. And one of the things that's concerning is it doesn't want to heal. So if we have a wound that's been present for several weeks, some of the things we start to consider are things like foreign bodies within the wound, or bony sequestrum. So if the bone is infected and the body's trying to reject that part of the infected bone, we'll see wounds that are non-healing. We already had our big long talk about location, and then veterinarians really quite like pictures. So if you're really concerned about where it's at, what it looks like, if it's really extensive, we're always happy to get pictures of the wound that you're assessing at home. So what to do, some of the things you can do while you're waiting for your veterinarian. Same thing with environment, take them to a nice, clean, dry place if it's safe. And you don't necessarily have to do any of the cleanup. That being said, if you notice something that has a significant amount of blood involved, is actively bleeding, or you start to notice things that are spurting or spraying at you, things that you can do in that situation, just like you or I, if you have a major cut, apply pressure or apply a clean bandage. So that'll help mitigate some of that extensive bleeding and give your veterinarian a ring. Some of the other things you can do as far as triage is moving them again to a clean environment, not necessarily cleaning anything yourself, but assessing things. So like your TPR, keeping an eye on, are their mucous membranes still pink and bright? Are they starting to get a little white if your horse is bleeding excessively? Is their heart rate starting to climb up gradually? You don't necessarily have to take a temperature, but knowing those things is always really important. And then care after is totally going to depend on location. The other thing that I would say too, while you're waiting, if your horse has a foreign body, and I'm sure everybody's seen this on Facebook, if your horse has a foreign body, like our lower right picture, if you notice something protruding, if you notice a nail in the foot, if you notice a stick sticking out of somewhere, don't pull it out. We want to see it in place. Some of the things you can do to stabilize those things, like a nail in the foot, is potentially place a bandage or call your veterinarian and keep them still. So they don't drive the nail any further into the foot, but it's still present, because we like to see, is there a track? The imaging is much easier when it's in place. And some of those, even though they look like maybe really, really small foreign bodies, some of those objects can go quite deep into structures. So it's much easier for us to assess them if the foreign body is in place. Fevers. I could talk all day long about this. So common causes, we're looking at infectious causes mostly. So things that we're seeing commonly in the area, tick-borne fevers, respiratory diseases, gastrointestinal diseases, those are all things that can cause fevers. So typically what we hear from owners, first and foremost, they're dull, they're lethargic, maybe they didn't eat their breakfast, they just don't seem interested in the things that they're normally interested in. I offered them a snack and they just were not interested in that. So not like my horse. Those are things that we typically notice first. So what we like to know is the duration of the fever. Some people will opt to medicate them themselves for a day, where they notice a low grade fever. Maybe we're at 1016, just kind of not quite right. Might opt to give them a little Banamine and see what happens. But if you notice that the fever has been going on for more than 24 hours, definitely want to know about it. A vaccine history is really pertinent, not only for us to know, hey, they were vaccinated 2 days ago, and they usually are a little sensitive, and today they have a 102 fever. But also what they've seen in the past. So strongly advocate for knowing when your horse was vaccinated, what they're vaccinated for, and how often they see those vaccines. Another piece of pertinent information, if you've traveled recently, if there's new horses in the barn, if you're in a large boarding facility where the horses are in and out all day long, whether it's horse shows, trail rides, meeting other horses from other barns, those are all very important things. And then our vectors. So things like ticks, mosquitoes, thinking of Potomac with the mayflies. Do they have access to water? Are they around water? Have you noticed the bugs are out really bad lately? Have you pulled any ticks off of your horse? Those are all important things as well. So some of the things you can do while you're waiting, again, your veterinarian may advise you to give something along the lines of buterbanamine, some anti-inflammatories, just to help that temperature come down and make them a little more comfortable, as well as cooling measures. So something that's really easy to do, and I love to have around for multiple reasons, but something along the lines of ice boots are lovely to have, or even taking them, finding some cold water and running it along major vasculature. So things like the jugular vein in their neck, and then the inside of their back legs along the femoral vein, and then their feet as well. So some of the things that we get a little concerned about with prolonged fevers are things like laminitis. So not only the endotoxic component to it, but those elevated temperatures for long periods of time, they can have some prolonged issues with their feet. And then the extensive diagnostics that your veterinarian may elect to do. So some of the things that we consider with these kind of unknown causes, while we're diagnosing what's causing the fever, are things like antibiotic therapy, diagnostics like blood work. May elect to do something like nasal swabs, or culture. And then continued NSAID therapy. The important part for owners is to continue to monitor those temperatures and their behavior as well, and letting your veterinarian know if they're not responsive to the therapy. All right, so things we can have at home to help us out. Gloves are always advisable, not only for gross things, but then for things like sheath cleaning, cleaning wounds, applying hoof packs and poultices. Those are all great things to have around. So multi-purpose, very cheap, very affordable. Thermometers, again, I'm going to get on my soapbox. Thermometers don't have just one thermometer in the barn. Have multiple. Go and buy a 5-pack from Amazon and have them everywhere around your barn. Digital thermometers are fine. You don't need one. They make one for livestock that's quite long. You don't need anything like that. A normal digital thermometer that you can get from Rite Aid, Amazon, wherever you want to access that, that's totally fine. I have been asked in the past, the thermal scanning thermometers don't work on our horses because they're haired. So will not give you an accurate representation. So wouldn't be inclined to get one of those for the barn. But the digital thermometers are great. Mercury thermometers are great. Just keeping in mind that you're going to keep your fingers on it or tie it to the tail if you're using a mercury thermometer so you don't lose it. But not having your one handy dandy thermometer is going to be very, very helpful, in that you don't have to worry about it breaking, it running out of batteries if it's not working, God forbid. The other thing I will say about taking a horse's temperature is when you always recommend using a little bit of lube or something to lubricate the end. It just makes it more comfortable for everybody. But when you're taking the temperature, make sure you very gently divert the thermometer to the side. A lot of times if our horse has a lot of gas in its rectum or manure in its rectum, if you go straight into the gas or the manure, you're not going to get a very accurate representation of their temperature. So taking it and pushing it a little bit to the side so it contacts rectal mucosa is a great plan. And it gives you a little bit more accurate representation of what their body temperature is. Having clean bandages, like standing wraps is a great idea as well, as you might be bandaging your horse for a lameness, or for a wound. Having vet wrap or stretch wrap is a great idea for bandaging wounds as well. Gauze squares or something similar. So like a nonstick pad is also lovely. Our Telfas, we hand those out like they're candy. So those are great things to have on hand as well. Betadine or chlorhexidine to clean things. Typically recommend for owners to have betadine on hand. Chlorhexidine, if we're using it near eyes, chlorhexidine can cause ulceration in the eyes, and sometimes can be irritating to our own hands. So betadine is really easy to access. You can get it over the counter. It's something you can find at, again, Rite Aid, or Amazon is easy. Having a triple antibiotic ointment or an ointment that you like to apply to wounds is also a great plan as well. Neosporin's okay. They make horse products that are really easy to access and get your hands on. So definitely recommend having some antibiotic ointment as well. And then medications. So I'm going to totally leave this up to your veterinarian's discretion. Some don't like to dispense them and have them on hand, but having things like a bottle of bute or a tube of Banamine paste is always a great idea in my book, in case you have an acute emergency and you need to give something before we arrive or before we have the ability to arrive. I always feel bad if a fever can't be seen for a couple of hours, where they could have Banamine and feel a little bit better by the time we get there. Some of the other things that they may elect to have you have on hand, a lot of people will have a bottle of SMZs. If you have a little wound, you have a little bit of a limb swelling, something that's really easy to have, keeps forever on the shelf. And it's something that Again, leaving it at the discretion of your veterinarian, something that's easy to have on hand and might be easy to start if you have it. And then sedation. A lot of people will have something along the lines of acepromazine injectable or tabs. I think sometimes that's nice to have on hand for like our choke situation, but not everybody has access to it, nor is everybody comfortable giving any sort of IM, IV, or injectable medications. Some of those sedation medications are really easy to give orally as well. Not that they have the same profound effect if you give them IM or IV, but that is always an option. And again, leave those at the discretion of your veterinarian. Some people don't like you to have access to them because, again, my NSAID soapbox is they can be used and abused and can be a little deleterious if they're administered too frequently. And then additional add-ons for travel. I think when you go to a horse show, it's very, very easy to forget your name tag on your stall. But to have it where you can have your horse's name readily available, your phone numbers readily available, the trainer you may be with readily available. A lot of those bigger horse shows where you're having to stable overnight, they're going to have nighttime security. And if they walk by and notice your horse isn't doing well or your horse is hung up in their hay net, they can easily contact you and know exactly where to find you. I always like to have several pairs of clean leg wraps. Again, if you have a swollen limb, if you're having to poultice things, it's always a great idea to have multiples. Or if you have a wound and you start to have any sort of discharge, contamination to those leg wraps, it's nice to have a clean one every day. Scissors, which sounds really funny, but if you need to cut anything, modify bandages, modify towels, cut your horse out of its hay net, anything like that, it's a great idea to have those on hand, as well as towels. So that's something that you could use to apply pressure, clean things up. Really good to have on hand. And then I would say a lot of these horse shows, the horse show bill will have the veterinarian on site in the bill. If you don't see that and you are stabling overnight, it is always a great idea to go into the horse show office and say, what are the numbers I need to know and who do I need to contact if there is an emergency, and have that saved in your phone, written on your hand, have access to it, take a picture with your phone. So those are all good things to have on hand as you're traveling. And above all else, we love getting phone calls. We love getting updates. We love pictures. So don't be afraid to contact your veterinarian. Ask us all the questions you have. We like hearing from you guys, and we'd rather hear from you in an acute situation than a couple days later.
Wonderful. Thank you so much.
Absolutely. It's my pleasure.
Okay, so if anyone has any questions, please feel free to put them in the chat. A question from earlier when we were talking about choke was, I've seen some postings that wetting feeds don't really make that much difference. Do you have thoughts on that?
I have found with my patients, I've made a big difference in a lot of those. I think I have a really hard time with the consistency. So I think we made a video through our Instagram actually on how to make an appropriate mash. So a lot of times, especially with those extruded feeds, some people will add a little bit of water, and while that puffs them up enough, it may not completely moisten them. So you risk the same thing where you can develop an esophageal choke as it becomes moistened by their spit, their saliva. So I think having the ability to make an appropriate mash is really, really important. And then talking about fiber length. So some of these guys, if they really have a hard time, I have some horses that quite enjoy the coarser forages. So doing things like finding a safe start hay that's already chopped, a pre-bagged chopped hay, or if you're feeling especially motivated, sitting there with a pair of scissors and cutting it up, which isn't like a fun way to spend your weekend, but it is something that you could potentially offer then. And then don't be afraid to go ahead and try other feeds. You can definitely do things like, instead of having an extruded grain, you can try something more of like oats. I find that the extruded grain's nice, again, that you can break it up. So I would say the most common thing that I have a problem with is inappropriately made mashes. But I would say in my hands, my patients do quite well afterwards if they're on a soaked feed and quite well soaked.
Great. Another question related to choke that just came in, is it helpful or useful to massage the throat, whether while you're waiting or?
Absolutely. Absolutely. So if you can feel, especially if you can feel the occlusion there. So a lot of times, again, going back to the anatomy, what you're going to see is, especially on the left side, your esophagus, the horse's esophagus runs on the left side of the neck. So if you can see the obstruction, it's a great idea. You can sit there and massage it. Sometimes that does break it up enough that it resolves it. While you're waiting, and it does, again, it gives us something to do. But yes, I would definitely advise throat massage if you can find that area of obstruction.
Yeah, and commiserating about cutting flakes of hay with scissors.
Yes.
I saw a tip online on Facebook about using a leaf shredder to chop your hay too.
Absolutely. I think it was when we got in trouble at our internship, but a lot of times what we ended up doing is, if we had horses that really did not thrive on extruded only diets, and they really like to have something leafy or have a little bit of additional forage, we would get sent down to one of the barns, and we would take the alfalfa and we'd pull it off of the stems. So you could offer them alfalfa leaves, and some horses quite love that. And that sometimes is enough to make them feel like they're getting enough forage or enough roughage that they're not dying, and they don't need to go down and hoover hay. And then a little more motivated to eat their grain as well.
Good question. We had a couple of good comments related to eye injuries. You could get like a racing goggles hood.
Yeah.
Someone else recommended the Guardian mask. Yeah, which I've experienced as well before. I had a question regarding appetite. One issue that I've sometimes had is my horse is on quite a large dose of percent, and I know that can suppress appetite. Like, when is it appropriate to try cutting that out to see if that's a difference, or is it worth doing that, or something you would advise against?
I always advise against stopping and starting, especially with the medication that like percent. And granted, I have had clients too, where you start them. Typically when we see that inappetence, that bout of inappetence is within the first 2 weeks of starting the medication. Typically they resume, although some horses are very fussy about it, and they figure out how to find the pill, the teeny tiny pink pill in their grain. A lot of times where I've found modifying things is helpful is if they figure out it's in their grain. I've had plenty of horses that decide that the grain is not what they want and not what they desire. So a lot of times what I'll have owners do is offer their breakfast on all of their feed, and then offer the percent after they're done eating. So they don't necessarily associate the percent with the food, and then they're still motivated to take that in. That being said, horses are smart sometimes. And as far as offering the percent, one of the things that I've had pretty good luck with, offer it in something different every day. So they don't have the option of figuring out what it's coming from, where it's coming out of. And then they don't associate that with breakfast or dinner either. But that first 2 weeks is definitely a struggle for some of our guys when we start them on it initially. A lot of times when we modify the dose, we don't see that significant bout of inappetence, but definitely can. And it can be quite frustrating, but I would say that's been my biggest golden ticket is offering it in something outside of their grain. So they don't necessarily associate that with their meal. But
yes, the links we go to.
Oh my gosh, it's like you have to offer something new every single day. I'm like, come on.
Yeah, they're smarter than we think. All right. Well, I know we're getting down to the end of our time today. We're getting some thank yous in the chat for a great presentation. If anyone else has any questions, feel free to take us home and wrap us up. But thank you so much. This is so informative. Lots of really great examples, advice. I particularly thought the the what to do while you're waiting aspect of each kind of area you covered was really informative. So thank you so much for your time. We really appreciate you joining us and being a part of the series. Lots of thank yous in the chat. So we hope you and everyone has a really great evening, and we'll see you soon.
Thank you guys so much.
Take care. Thanks again. Thanks again so much. I'll stop the recording.